is Molly, and today I will be demonstrating the use of the Gracey 1-2 Curette. So this is what it looks like, and the main purpose of this instrument is to scale both the facial and lingual surfaces of the anterior teeth, and that goes for subgingival and supragingival calculus. And so the instrument has a rounded toe, so that allows the instrument to go subgingivally. And then also the blade is offset. And so you use the lower cutting edge as the cutting edge only. And you can identify that when the terminal shank is angled slightly toward the surface or the edge that you're working for. So this instrument is just used for the anterior teeth. And so next I will be getting into my demonstration, and throughout the demonstration also I'll just be using my modified pen grasp and fulcruming on my ring finger. So I'll get into that next. Alrighty, so I'm starting on the facial surfaces on the maxillary arch, anterior surfaces toward me. So I'm starting on the midline of the tooth of that canine, and then working my way on the distal side, rolling my instrument once I get towards the line angle. And I know I'm using the correct side of the instrument because I'm just using the lower cutting edge, and the instrument tilts slightly towards the surface that I'm working on. So I'm just fulcruming on my ring finger and activating with lateral pressure to remove calculus for a removal stroke. And I'm going slightly subgingivally on these teeth because the instrument has that rounded toe, so it can go subgingivally. And I want to use short controlled strokes, so a couple millimeters. And now I'm moving to the lingual surfaces, maxillary surfaces toward me on the anterior, and so I'm gonna use my mirror for indirect vision to see these surfaces. Once again, starting at the midline, and since the blade is offset already at that 70 to 80 degree angle, the shank of the instrument is going to be parallel to the long axis of the tooth. So this is different compared to, for example, the universal curette or the sickle scaler, because those instruments you have to angle the instrument at the 70 to 80 degree, but because we already have established the instrument with the Gracey curette, it's already built with that angle. We'll just keep the terminal shank parallel to the long axis of the tooth. So I'm just working my way interproximally, and I want to roll at that line angle, as I mentioned earlier, to make sure to reach into any calculus that might be interproximal. So now I'm doing the surfaces away from me on the maxillary arch, the anterior surfaces away. So once again, I want to make sure I'm using the correct working end of the blade so that the surface or the instrument is tilted slightly towards the surface I'm working on. And for surfaces away, I moved to a 12 o'clock position so that I can rock on my fulcrum and activate with lateral pressure to remove any calculus. So that's different from surfaces toward me. I'm sitting more at a 9 o'clock position, but that can vary slightly. And so we could see here, I'm just rocking on the fulcrum and using direct vision for these surfaces. So now for the lingual surfaces away from me on the maxillary arch, I'm still at that 12 o'clock position, but now I'm using the indirect vision. So just starting at the midline of the tooth and then rolling my way around the line angle. And here, once again, I want to keep the terminal shank parallel to the long axis of the tooth. And I have my working end, the correct blade, that's tilted lower. That's how I can also visually see it too if I'm just looking straight at the instrument. Alright, so now for the mandibular arch, starting on surfaces toward me on the anterior. So, of course, I have my correct working end. I always check that before I start. And here I moved back to my 9 o'clock position to do these surfaces toward me. And trying to think about keeping the instrument nice and upright in order to keep it parallel. It's something I kind of have to remind myself so that I have the proper angle of the instrument. So now doing the mandibular lingual surfaces toward me on the anterior. I've changed the side of the instrument that I'm working on, that I'm using, so that I'm using the lower blade and using indirect vision with my mirror. And these are surfaces too I've been working in clinic to be more effective. So this is kind of my main area of focus. Just making sure I have correct adaptation with that tip 1/3, and I'm using enough lateral pressure, but just rocking on my fulcrum, and yes, importantly, keeping the angulation so that the blade is 70 to 80 degrees to the tooth, but that the terminal shank is parallel. So now I'm doing the facial surfaces on the mandibular away from me. So making sure I'm using my correct working end. And for all of these teeth, I've just been working obviously just canine to canine so that I don't miss any teeth or anything like that. So as I've been doing, starting at the midline of the tooth and then working my way towards, in this case, on the surface away from me. So want to have a good steady fulcrum and a good angulation to have effective calculus removal. And then the last surfaces I'm going to be doing for this video is the mandibular surfaces lingually, surfaces away from me. So on my 12 o'clock position, I'm going to have the sit the patient up a little bit and use my mirror if I need to. Use my mirror so I can see everything really well. And I want to make sure that I'm just using the tip 1/3 of the instrument with the blade, the lower blade, when the instrument is tilted towards the tooth. So there we go. Alright, so that was my video of my demonstration using the Gracey 1-2 Curette. And so I'm just going to keep practicing on my adaptation and my efficient calculus removal strokes with my lateral pressure. So I'll keep working on that. And next week I'll be going into the Gracey 11-12. So thank you very much for watching this video and have a good day.